Welcome to Autism Today. It's a show about autism and issues that we think are relevant to people living with autism, to families, and to members of the community. Today's show is going to be our introductory show, and it's a show about where we should get started with this, which is what is autism and how do we diagnose it. But over the course of the next several shows, we're going to cover topics that can range from the research on intervention to biomedical research to things that are more practical, such as how do you toilet train a child with autism, or how do you manage difficult behaviors? How do you take your child with autism on vacation? So we hope that the show will be informational and practical to a lot of people, both who have autism, living with autism, or just the general community. Today we have a couple of very exciting guests, and as the shows go on, we will have many people who will come on who are experts in autism or just have had a lot of experiences that will be practical and relevant. So today's show, as I said before, is going to be about what is autism, how do we diagnose it, how do we look for it in young children if we're worried about what might be happening with our child, and we will be starting with our first guest, Dr. Ira Cohen, when we come back from the break. Welcome back to Autism Today. I'm very excited about our first guest, Dr. Ira Cohen. I've known Ira probably for 25 years at least. He's the chair of the psychology department at the Institute for Basic Research right here in Staten Island, New York. He's done a lot more work and research in the area of diagnosis and identification of autism than anybody I know, and he's well published in the area. So I'm very excited that he's here today to talk to us a little bit about what autism is and how it's diagnosed. Welcome to the show.
Thank you, Joanne.
So I know a lot of people don't really know what autism is, and it's hard to explain in a short period like this, but if you could just give us an overview of what it is and in a layperson's terms.
Okay, I'll try. It's a disorder of development, and it's from a family's point of view, it's very disheartening because it affects three basic things that a child needs to develop. One is communication, and the second is socialization, and the third is the child's imagination, how he or she plays with toys. And it is the fact that those three areas are affected really impacts the child's ability to socialize and interact with other people, first with the mother and the father, and with the siblings. And so it's very disheartening. The types of things one sees are problems in making eye contact with other people, problems with responding to their name. So you call the child's name, doesn't respond, you do it again, the child doesn't respond 3, 4, 5 times. And sometimes the parents suspect the child may have a hearing impairment, and the parents get the child checked and the hearing is fine, there's nothing wrong. The second thing is the child's language fails to develop. And if it develops at all, the first things you'll notice is that the child may repeat back words that he's heard, and there doesn't seem to be any meaning behind it. It's as if you were talking to a parrot. And the last thing is most children develop early play skills. They want to interact with objects and they want to interact with other people in a social play situation, and these kids don't do that. So it is those three areas, the triad of impairments in autism, the fact that they engage in these or fail to engage in these social communication behaviors and have problems with imagination. Then you see some what would appear to be rather odd behaviors appear.
Right.
So we have those motoric disturbances like hand flapping or finger twiddling, spinning in place, or repetitive toy play.
So let me ask you a question. What does it mean, because I've heard people use terms like my child has PDD, or people use the terms autism spectrum disorder. So generally, what does that mean? Okay,
well, the term PDD stands for pervasive developmental disorder. It's a term that really came into vogue when the DSM, the Diagnostic and Statistical Manual of Mental Disorders, came out in 1980. The third edition came out. And that's when the term pervasive developmental disorder came. Right. And under that general umbrella term, under that general rubric, there are various kinds of PDD. And the fact that it's pervasive means that it affects multiple areas of functioning. It's a developmental disorder. Prior to that term coming out, autism was considered to be a form of schizophrenia. And research has indicated they're not really related. And people realized it was a developmental disorder, and so this pervasiveness of this of this problem became apparent, and that's where the term came in. The spectrum term came in more recently, and it was the notion that what you're seeing is a range of problems. Some kids being the more classic type of autism you see in the movie like Rain Man, and others having more subtle problems that often may not appear until the child is in first or second grade, and then he or she is having difficulty interacting with other people.
More of the social problems.
More of the social problems, right.
Right. So if I were concerned about my child, because I know you can't get a blood test and say you have autism,
Right.
So how is it diagnosed, and where would I take my child? What would be your recommendations? Maybe you could explain what the diagnostic process is a little bit.
Okay, I'll try. It's going to vary with the diagnostician. Well, I would say any parent that has a concern about the child's development should bring the child to, well, first the pediatrician. That sometimes works, many times it does, and it varies with the experience of the pediatrician and his or her practice. If most of the people coming into the pediatrician's practice are perfectly fine, it's going to be the rare pediatrician who's going to recognize a child who's going to present with more subtle features of autism. I mean, if they're blatantly not responding to others, that's one thing, but if there are more subtle features, that's a problem. So if there's a concern from that point of view, then you should seek out an experienced diagnostician. It could be a developmental pediatrician, a pediatric neurologist, a clinical developmental psychologist, clinical psychologist, somebody who has experience with this condition.
Right. So I guess, because I know so many parents have said to me after their child was diagnosed at, let's say, 3, that they knew there was something not right about their child's development, but their pediatricians kept telling them to wait.
Right.
So I guess if you're really concerned and you take your child to your pediatrician and your pediatrician says wait, you would suggest that they really probably seek out somebody that has more qualifications in autism?
Yes, I would say if there is a concern, and there's still a concern even if the pediatrician says wait, I would certainly seek out other opinions because we know that early intervention helps.
Right. So how do I know? How do I find somebody that has qualifications in autism? You know, what they don't have autism certifications.
Well, I mean, nowadays we have the internet, right?
Right.
You could go on the internet, do a search, and there are websites that you could go to get information on who's an experienced diagnostician in the area. There are parent organizations that you could go to, and you type in autism or autism spectrum disorder or Pdd on the web,
Right.
And you'll be able to get that information. And also there's word of mouth. From speaking to other people. If you have a really good pediatrician, then he or she can make those recommendations.
If I took my child to, let's say, a pediatric neurologist or a psychologist, what would the evaluation look like? So how would I know that I actually, you know, how long would it take, and what kinds of things should I expect?
Okay. Well, in a typical pediatric practice, which is usually a bustling practice, they don't have a lot of time to do intensive analysis of the child's behavior. When you go see a professional, they will give you more time. And sometimes they may do developmental tests. They'll do tests for autism, looking for autism spectrum behaviors. There are now well-validated observational procedures for determining whether or not a child's behavior looks suspicious. There are parent interviews and parent checklists that are around that we can utilize to get that information. So if you can combine all that information strictly from a behavioral point of view, because we're dealing with a behavioral diagnosis, I think it's important for families to recognize this is a disorder that is diagnosed because the child meets A, B, C behavioral criteria,
Right.
not because of a blood test, not because of any medical evaluation the child has, at least at this point in time.
Right.
And there's research in the area suggesting we may eventually get there, but not yet.
Right. Okay, so it can't be a quick thing. It's going to be...
It's going to be a while. Right.
And I guess that, you know, there are other terms. So, for example, some families said, well, my child got diagnosed with Pdd NOS,
Right.
but then somebody else said, no, they have autism. Somebody.
Right.
So there's all these other different things that fall, I guess, under the umbrella.
Right.
Could you just kind of give me a brief, what's the difference between Pdd NOS and autism, or autism and Asperger's disorder?
Well, that's a good question.
Right.
And in a couple years, it's going to change rapidly.
Okay.
As I said, before 1980, autism was considered a type of mental illness similar to schizophrenia. And in 1980, they had this idea that it really wasn't, and based on research, just not out of the blue.
Right.
And there were 3 kinds of PDD at that time. And then in 1987, it went to 2, and more recently, in 1994, it went to 5.
Right.
So we have typical autistic disorder, which is all of the problems I described earlier. We have something called Asperger's disorder, which ostensibly means that the person has problems in socialization, has problems with engaging in repetitive activities or ritualized activities, but has no problems per se with language. Their language development was normal, unlike the typical child with autism. And their IQs tend to be rather high, or at least average, okay? Whereas most kids with autism test in the intellectually disabled region. There's another disorder called Rhett's disorder, which is a problem with the X chromosome, and it only affects girls because boys usually don't survive to have the condition. And it's a very debilitating condition. And then we have this thing called Pdd Not Otherwise Specified, which, as its name implies, is a very vague label.
Yeah.
And in research, people have found that it's very difficult many times to distinguish among PDD-NOS, Asperger's, and autism.
Right.
Not so much Rhett's, that's probably going to drop out. And I forgot to mention disintegrative disorder, which is a very rare condition, but this is the case in which a child is developing perfectly normally up through 3 years of age and then loses skills and looks autistic.
Right.
And if anything, those are the cases where you really think there's got to be an organic problem, and you look and you don't find anything, and it's very disheartening.
So you can see how complicated, I guess, it is and why it's such a maze that parents have to navigate through.
That's right. And the fact that one diagnostician says the child has autism and the other says they have PDD-NOS, it's probably doesn't mean a lot.
Well, we're going to continue this after the break, and we're going to bring on another person to help talk a little bit about some of these early signs, Dr. Jane Weiss. So we'll see you all in a few minutes after the break.